Good morning. Very nice that this year for the second day, mainly person are here because last year, as I remember, like for the first day was lots of people and the second day was like 40%. So I'm happy that we are here. Unfortunately, the topic is a topic from last year, and this year I would like to talk more about the solutions. It's very common. It's for me. It's we are all here in line because we are all talking about as much data as we collected, as better healthcare we could provide to our consumers. So 5 years ago we decided to call patient consumers because patient is only person who came to the hospital. And if we are talking about the preventive care, if we are talking about longevity, we are call them like consumer, healthcare consumers. So let me introduce myself. My name is Egor Safrygin. United Medical Group is a company who manage several hospitals. We work in Saudi Arabia. We work in from last year also in United Arab Emirates, originally from Cyprus and Gibraltar. Now we are work also in United Kingdom. Under our management is a big hospitals also in Russia, so we are, very frustrated about the situation around the world. But we are talking about the medicine, we are talking about the healthcare, and we care about the health of our patients, never mind where they locate. So, this. So. I have 2 videos, and they will be at the end of my presentation, and they will cover all solutions that we provide. Unfortunately, Robert left us because we have a very similar solution that we provide to our consumers. And why we decided several years ago to be more focused about the data that our consumers have in their cell phones. Because the smartphone, they like very smart, but unfortunately when the consumer or patient came to the appointment to the doctor, what we faced with, especially neurologists or cardiologists, after 1 month, each patient should create self-observing diaries. And how is going on? These diaries fill it like 15 minutes before the appointment. So doctors should believe the patient. And in 100%, the all information that doctors see in these self-observing diaries is just created like 15 minutes before. And there is no like real information provided to the doctor. So we decided if our patient have lots of course, not like medical records, this like paramedical, we have like a we have like medical devices, and we have just fitness devices. And we decided, of course, this information we can't use to create the electronic health records, but we could have this information just for understanding why the patient, when he or she came to the doctor's appointment, felt corrected and nothing happened with the health of this person after 1 month. So we created like several apps, and this year we understood that when we change our workflow and we changed the documents management for last 5 years, we saved more than 500 trees because we stop use of paper. We do not print now any medical reports, so all reports are in the apps, And if patient would like to share these medical records, he or she could send these reports and other medical information, because these medical informations belong to the patient. So we do not belong of this information. So and this year we was awarded for the International Sustainability Awards, because for 5 years we saved like more than 10 tons of the paper we're not using anymore. So when we are talking about the digitalizing, we also talking about the ecology, because we also stop to use, if it's possible, plastic in hospitals. We more use paper, because it's also better for the planet. So the digitalizing is the way for the better future, for the healthier future, and for the future where is for the ecology we put on the first stage. So 5 years ago we created the digital ecosystem. All our hospitals combine in one network. Of course, we work in different medical records in Saudi Arabia and in United Arab Emirates, but in general, our patient, our consumers has not call. So we have a call center, but 67% of all appointments our consumers can make via the apps. And this is a great solution, because yesterday we talked about that I'm, as a consumer, should wait on the phone line years and years. So now we decided to create these apps and to help our patient to be more flexible. Also, yesterday, we talked about the telemedicine. What is telemedicine? Previously, telemedicine was like a phone call or just a video call. And before the COVID start in 2019, we changed our mind about the telemedicine, because we start to use Israeli gadget medical solutions, the tighter care. I think our colleagues from Hadassah know what is tighter care, because previously when doctor see just face of the patient, he or she should just believe how the patient feels himself. And when you started to use the instrumental diagnostics, the doctor on the screen could see the heart rate, the lung rate. When patient at home, they could use all diagnostics they could make in a hospital. So now we are talking about the telemedicine 2.0, because it's a new reality. And the tighter care helps us to reduce, especially in pandemic or in just classic autumn-winter season flu, not come to the hospital, not bring their children to the hospital, just do all examination at home. And the doctor believe not only to the words, the doctor believe the information they receive to their screen, never mind where is the patient is located. So for me, as more digital tools we have in hospitals, in clinics, as more results we can bring later, because when consumer of healthcare services and solutions have or has everything inside their own smartphone, it's stay very flexible to choose right doctor, to choose right appointment, to choose right treatment, to cancel, to reschedule, everything in one click, everything possible in one field. So, but later when we created our own app, we understood that doctors always under the pressure, because when the consumer came to the appointment, they have to write what was going on with the patient. And as we see, all of us would like to be more nice. And when you have an appointment with a doctor, sometimes you never tell the truth to the doctor. And this is very important, because the treatment will be depend on these words that the patient say. So we understood that we have like Apple Health, we have Google Kit, we have lots of devices, and medical devices and not medical grade devices. But when you use the smartphone, you sign like a contract with Apple or with Google. So you sign this contract to use this information to the corporation and Google and Apple. And we decided, why, if our patient signs these contracts with global corporations, why we won't do the same? So we created our data hub solution, and now we use all information regarding the health, around 350 different combination about the health from the smartphone. So we use now all information from Apple Health, Google Kit, wearables, and other apps. Sometimes when the doctor prescribes to use medical devices, we also use in our data hub the medical devices that were prescribed by the doctor. And when we received all this information, so it's updated automatically. When information was updated in the smartphone, it's updated in the doctor account. The doctor sees the all information. Robert yesterday have a very nice visualization how it works. So we have the same. And it's very important for doctor, because yes, this is not medical grade information, but it's important for doctor for understanding, okay, I should call to my patient because something is not good, and we should make an appointment and to put real grade medical gadgets in clinic for better understanding what is going on, what is happening. So for example, I've been in hospital. In the same moment, the doctor is monitoring the patient, and in the diagram, it was like heart rate like 240. One time, another time, like for 5 minutes, 5 times. And doctor called to the patient, and the patient was very happy. Oh, I'm running on the bicycle. But what with your heart rate? I drink like 5 espresso. That's it. So doctor was like confused. What is going on? What is happening? But patient just at the same time drink coffee and do the bicycle works. So this helps to understand what is going on and to be more helpful for our consumers. So how we use this information? We have our CRM system, where is our sales guy works. We have our customer developer platform when we send the information to our patients. And of course, we can't use officially this information to put it into the health records, electronic health records. But we use the information we receive from all these gadget apps for making next appointment and to regulations the treatment. So it's like officially, as a hospital, to the politics, we can't use this information because it's not medical grade, but it's like lifestyle. And we have now be more focused on lifestyle of our patients. So we use all this information for doctors. And I just want to show you results. So for last 2 years, as we use all data from like non-medical grade records, we increased our net promoted score from 72 to 85, because consumers and patients are more happy now, because we are, as a healthcare provider, more in touch with them and propose them very tailor-made treatments and appointments as it was before. Regarding our database, we have like more than 1,500 users a day who use this system, and data from which gadgets transfer into our data hub. Regarding the money, because we are like a private hospital, we should earn money for our shareholders. We twice increased the average bill for the patient who use this system, because if previously the patient or consumer came to the doctor and doctor prescribed treatment or a diagnostic, and the patient or consumer was, okay, sorry, no, it's not for me, I don't need it, prove that I need it. And now we don't need anymore to prove, because patient, consumer, and the doctor see the same information, and doctor nowadays hasn't like to prove it. The patient see this, okay, something wrong, okay, the doctor right, I need do this, and this. That's why also we increase the number of services. So if previously a year each patient used around like 20-25 services in a hospital, in clinic, now we have like more 50 plus. And here to here we have like 30% visits more. Visit like also the telemedicine, because sometimes the patient who have like instrumental diagnostic like titer care, they hasn't to go to the hospital. They have like titer care, they call to the doctor, they make this remote consultation with instrumental diagnostic, and they also visit, because never mind is it like offline or online, it's visits, so we increase it. So what should I do?
The European Medical Centre is a part of the United Medical Group CY. For 30 years, we have combined the highest level of service, modern protocols for providing medical care, and the most advanced equipment and technologies. One such innovative tool is mixed reality technology HoloLens, which allows visualizing digital data in the surrounding space. Mixed reality glasses enable UMG doctors to interact with patients' computed tomography results during surgery and preparation, providing highly effective spatial navigation, reducing time and minimizing the consequences of surgical intervention. UMG is the future of medicine, and it's already here.
So this is also a little bit explanation how the digital solution helps the doctors and the patient. In 2019, we together with Microsoft, we started to create this platform for the surgeries, because maybe everybody knows here what is HoloLens, what is augmented reality, but this solution wasn't created for the healthcare. Since 2019, two years and a half, we created together the platform. And now all our surgeries use the HoloLens, and in average, we decreased the surgery from 15 to 30 minutes, because now the surgery and the surgery assistant can see all information in the screen, and they does not need to change anything, and as less anesthesia the patient get, as more healthy brain stay. So we also, when we're talking about the digital health, we are talking about how to save the quality of the patient life, and how to be more effective from the healthcare side and from the patient side. So this is was just an example how we use the digital in our digital ecosystem. And the second video is about how our app works, and we also decided to demonstrate and to show from inside how to be not outside of the app, and what is going on and what is happening inside of the app.
United Medical Group is a lifelong health partner. The UMG personal account is your digital interface for interacting with the clinic. With it, you can get access to your medical card, laboratory test results and investigations, doctors' recommendations, cash flow, and other services at any time. The application will remind you to take medicines according to the individual doctor's prescriptions. Our digital services continuously monitor more than 650 health indicators, consolidating information from the integrated sensors of medical devices and applications that use HealthKit. All received data is delivered to the information system of the clinic. Analyzed by the artificial intelligence, it informs the customer on his health state, and it's also being delivered to the doctor, who makes decisions on the remote consultation and diagnostics necessity. Using a UMG personal account, you can sign up for an appointment to the clinic, request a home visit, or undergo teleconsultation. Having drawn up a UMG health plan with your personal doctor, you will be able to track recommendations and prescriptions in dynamics, as well as receive the results of your tests online. With UMG personal account, you can take care not only of your own health, but also the health of your loved ones, easily switching between the profiles of your family members. Live life to the fullest while UMG takes care of your health.
So if 5 years ago around 98% of appointments was created by phone, now around 70% of all appointments and all communications with clinic are inside of the app. So we are refocusing of our call center more for the like sales and telesales, and all our doctor assistant have their personal account inside and can chat inside the app. Of course, we have like around 30% of our consumers who are not liable to download the apps. So they like any reasons not to install the solutions. And these clients use, we have WhatsApp Business app platform. So as a hospital, we use also WhatsApp for making appointment. and to communication with our doctor's assistant inside our platform. Because also 5 years ago, all department has like 1, 2, 3 like phones with WhatsApp and personally texting with the patients. 2 years ago, we transfer all to the platform. We could control all communications. The supervisor could join the thread if they understand that the assistant is have not a lot knowledge about the products, etc. So we are very focusing on digital solutions because we strongly believe as more information we receive automatically from our consumer, as more efficiency we could be as a healthcare provider, especially when we are talking about the preventive care and when we are starting talking about the longevity, because the future of digital hospitals is now, because lots of healthcare providers try to fix different solutions with their patients or consumers remotely, and and in hospitals it's like only surgeries or emergency. That's why as much data we have, as more efficiency we could be in our collaboration with our patients. So thank you so much. If you have questions, I can answer. I have like 3 minutes 54 seconds, so we are in time. Thank you.